To be featured. Good morning. It's so great to be here on the 9:30 call, where we're going to continue to focus and highlight parts of the early childhood agenda on the call. And so we're so excited today to be focused on the early childhood agenda work group 9, which is strengthening the links between health and early childhood systems. And we're so happy to have with us today the facilitators, Alex Chu and Allison LeBlanc. So I will ask both Alex and Allison to first tell us a little bit about each of you and how you came to be in your kind of daytime roles. And then we'd love to hear about kind of how you came to be the facilitators for Work Group 9.
Great. Thank you so much, Amy. Thank you for having us this morning. I'm Allison LeBlanc. In my day job, I'm Executive Director of the Child Health Equity Center at UMass Memorial Health and UMass Chan Medical School. So that's in central Massachusetts, based in Worcester. The work that we do at the Child Health Equity Center is really to address adverse social determinants of health, including racism and poverty for children and families in Worcester, Massachusetts, and beyond. So we have some hyper-local programming, and then we have some regional programming, some national programming, and a few international projects, which is very exciting. And we got introduced to the early childhood agenda by a colleague from Together for Kids, which is a great organization in central Massachusetts that we participate in. And folks from Strategies for Children actually came to our annual Child Health Equity Summit to present about the early childhood agenda. And during the summit, one of the things that folks shared as feedback is they thought that the Child Health Equity Center should get involved in number 9. So I think that's what sort of landed us in this position. And I'm so grateful to be partnered with Alex and Reach Out and Read on this project. Alex, you want to introduce yourself?
Absolutely. Thank you, Allison. Hi, everybody. My name is Alex Chu. I'm the Executive Director for Reach Out and Read here in the Northeast. Reach Out and Read, in case you're not familiar with, is an organization that partners with pediatricians and family medical docs to support literacy in the well child visit. Across Massachusetts, we serve about 400,000 kids and families, and that's about 6 or 7 out of every 10 families in the Commonwealth right now. We were lucky enough to be a part of the original drafting of the idea of the agenda, and then how we came to be a part of work group number 9 was that we hassled Amy and Titus enough to let them be a part of the healthcare connections piece. So we're here by force of will and attrition, but I'm thrilled to be part of this, and very grateful to be partnered to Allison in this work.
And so just a word as we kind of get into this. So I think, we'll put the links in the chat of the early childhood agenda. And then as we went through the process in the fall of 2022, we wanted to know kind of what topics people were interested in, and kind of, cast this wide net. Over 1,000 people used group maps, or this incredible tool to think about, how do we capture all the information? How do we represent the voice of the people who are doing this work in many different ways? How do we get beyond early education and care? And it has been really exciting to think about what could be, to kind of be together in that space with folks. And so, as folks know, we got all this information. Everybody voted on the priorities, and so the 10 priorities that came out were kind of voted on by all the people that had been part of the process. What we also knew as part of the process is there were already existing coalitions that were doing some of the work that was highlighted through that process. So affordable access to childcare was, the Common Start Coalition. And so we wanted to make sure that we were strengthening, connecting with, bolstering the existing coalitions, and think about the infrastructure that we needed to help support some of these ideas that many people were interested in, but there might not have been kind of one place where you could go. And so that was true for this topic around making these connections. And so I think, as Allison and Alex talked about, there are many different ways people came to the work, but putting this infrastructure in place took almost a year to find facilitators, lived experience leaders, to make sure that those voices were part of the work groups as well. And so Alex and Allison, if you want to talk a little bit about that process. Oh, the other piece that we've also thought about is somebody from Strategies for Children has been sitting and being on each of these teams. So Neri is your SFC rep, and we know that Amanda and Jeremy and Marissa have been doing a lot of the behind the scenes work. So it's a full SFC effort. But can you talk a little bit about maybe like that process? We also know people are at all different levels of development. You know, partners have never worked together. Some of the issues just require a different level of collaboration. So can you talk a little bit about the process and kind of where you are now?
Sure. And just a shout out to Amanda and Neri, who have been amazing through this process and really helped guide Alex and I and saved us from ourselves in some cases. They have been wonderful. I think we have a really big job with number 9. So ours is linking health and early childhood systems, which when you think of one of those just on its own is massive. And then you try to think of connecting them. It's a daunting task. So we have a great work group that is convened to kind of talk through some of these issues. And I think, just for transparency, the process has been challenging, and I think challenging in a good way. I think we have a lot of really diverse perspectives, and we're trying to understand, what exists currently in terms of linkages, what might exist aspirationally, and what can we do to get there. And I think, because we have such diverse stakeholders, people's perception of what is and isn't working is slightly different. So I come from a more healthcare background because I work in a hospital system. And then we've got a lot of folks on our work group that come from an early childhood background. And, the perspective of the challenges is very different. And I think what's been really beautiful about this is that we've been able to kind of understand each other's perspectives and challenges so that we can try to build something that is beneficial for all. And one of the approaches that we've taken to do this as of late is really try to lift the conversation up to a higher level, focused less on creating an individual position or something like that would link the systems, and more focused on the hierarchical systems themselves and how we could create a connection. Because I think what we found, both on the early childhood side and on the healthcare side, is when solutions are position-based, it can be inequitable in terms of distribution and access. So there might be some geographic areas that have the resources to hire those positions that create those linkages, and some areas that don't. And so if we focus on the system, we're hoping that we can create system-level solutions that will then allow for an equitable resource across the board. Because the last thing we would want to do is create more inequities where there already exists plenty of inequities in early childhood and in healthcare. And I'm going to turn it over to Alex, who has some slides. I think he's going to pop up to show you where we are.
Amy, I think you're the host on this one. Can I share screen? Do I have capabilities? Amazing. So I'm going to just take a couple minutes to share screen, and then to talk a little bit about our last session. So this may be a little bit repeat for folks who are able to join us on the last work group session. But for the folks here on the 9:30 call, I want to just share what our last session was like, and some of the questions that we're grappling with, and how we're trying to organize around all of the pieces that Allison just shared, all of those complex thoughts, the positions, the approaches, how we're trying to take all of that information and bring it together into a functioning system that helps us think about how do we get to outcomes and outputs and strategies that'll help us move this ball forward. So I am very bad at actually doing the slide share presentation. So I'm going to hide this top bar and pretend like this is slideshow, so it doesn't do the whole multi-screen thing. But here is some of the organizing principles that we have sort of wrapped our heads around. The actual and exact language and what we are trying to tackle, what was originally created, the way that Amy framed this so well for us is strengthening the links between medical professionals and other early childhood programs and services. And even in that statement in and of itself is a super loaded statement like Allison was talking about. What do we mean by strengthening the links? Who are we talking about when we talk about medical professionals? When we talk about early childhood programs and services, which early childhood programs and services are we talking about? Are we talking about WIC? Are we talking about Head Start? Are we talking about EI? Are we talking about childcare? Are we talking about all of them? Are we talking about a few of them? And so when we think about this, part of wrapping our hands around this context is, how do we think about this in a way that doesn't give us analysis paralysis and lock us into thinking about all of the thoughts that could be versus trying to move this forward and address some short-term and immediate impacts and outcomes as we think about what does that long-term vision look like for the linkages between healthcare and early childhood. And all of this is framed around a lot of community involvement in trying to get our hands wrapped around what are themes out there that the sector is experiencing. And this was through work that Allison and her organization has done at the Child Health Equity Summit. We saw some themes about cultural competence. We saw themes about referrals and follow-ups and using navigators to facilitate warm handoffs. The early childhood agenda planning pieces saw a couple of strategies really elevate around childhood development specialists and the role of child care health consultants in the early education and care space. And then even the work group itself has had a good bit of time in grappling with, okay, so what is the existing infrastructure out there for linkages? What's the asset map that we've done across the community, not just in large urban areas, but across the Commonwealth? And how do we think about how we organize as we move forward? And part of what the work group has decided is to facilitate this process using a sort of logic model or theory of change organizing structure. And essentially, if you're unfamiliar with that process, it's a process in which if you have a lot of complex ideas or a lot of complex thoughts, how do you take them and organize them in such a way that allows you to sort of connect what happens at a strategy level to the outcomes that come from that? And then collectively, what outcomes from that lead to additional impacts that can have larger scale effects. And so you get this laddering effect that looks like, how do we take small little bits and pieces of things and link them together in order to get the kinds of impacts that we're looking at. This is sort of reflective not just of our work group number 9, but as we've started to think collectively about bringing the work groups together. And I know Strategies has done a great job of bringing folks together and talking about shared challenges and successes across work groups. One of the things that we're hearing is, how do we organize that information? How do we think about activities in the scope of actually making impact across all of early childhood? And so the steps that we're organizing under within that theory of change right now is thinking about what goals and how specifically do we want to address those goals? How do we define what that means? And so that sort of organizing challenge that I said at the beginning, how do we think about healthcare? How do we think about what does it mean to strengthen links? Who is early childhood is what we're working on as far as definitions are concerned, so that we can get to the strategies that we want to see and the outcomes that we want to get. I realize that this is a short call, so I'm going to get right to the learning so we can get to Q&As here. But some of the things that Allison spoke about at the beginning are things that we are trying to integrate in all of the processes that we're doing. So we are trying to narrow that scope and think about how do we accomplish things over the next couple of months, and thinking about the sort of end of the fiscal year and end of the agenda period that we have here. How do we accomplish some things here? And then how do we move forward with some of the larger things? We have learned that working with medical professionals, we know this sort of inherently, but working with medical professionals is exceptionally challenging. And part of that challenge is because they have timers and 15-minute well child visits and all of those challenges that we in the early childhood sector normally expect. And then on top of that is ongoing RSV and flu and COVID, so much so to the point that in some instances, Allison has sort of highlighted that hospital systems and clinics are sort of shut down to participating in these kinds of events and work groups because they are so focused on treating sick and ill folks across the Commonwealth. And so thinking about how do we make sure that we're bringing in a medical clinician perspective in order to inform some of the pieces that are coming out of the early childhood agenda is and has been and continues to be an ongoing challenge. And then as we think about things future facing, making sure that the strategies and the outcomes are aligned, making sure that that all reflects back to addressing the goals that are defined sort of at the outset here. And then having reflections about whether or not the theory of change and the logic model that we're putting together actually makes sense. So thinking about, do the interventions and the strategies, are they relevant? Are they respectful? Are they meaningful to people and communities, like Allison was saying at the outset? And do these pathways recognize and make use of existing community assets to navigate bias and avoid harm in the space? And where we can address existing inequities, how do we do that? And how do we think about that space as one that is community inclusive and supportive across kids and families? So I will pause there. Whoop. Oh, I got a whole bunch of things here. I will pause there and say that's sort of the quick and dirty overview of work group number 9. I think happy to take questions or sort of reflect on anything that folks on the call want to.
Thanks so much, Alex and Allison. There is a question from Suzanne. I love all of this and that you're paying attention to the ways that systems designed to support people can actually widen existing inequities. One of the most ableist systems in the US is the medical system, and a close second is our education system. Can you share more about how you're addressing ableism in this work?
This is such a good question. Thank you for asking this. It's a topic very close to my heart. I think, yes, the medical system has a long way to go in terms of working on and addressing ableism. A fun fact that health systems in the US are just this year starting to collect data on disability. So prior to that, there was no data on disability in people's medical records as required by CMS, which is frustrating, I think, for a lot of us advocates out there. But I think will help us better understand the demographics in health systems, and also help us understand how we support healthcare providers and also, early education and other folks in understanding the unique challenges of individuals with disabilities. And, abilities are a spectrum, right? And so there's a lot to understand and to appreciate when you're trying to make things more accessible and to combat ableism. So I think a lot of our work is really to think about things from the highest level so that we can ensure that we're really seeing the full scope of challenges across all of the stakeholders. And that includes not only understanding ableism, but understanding the intersectionality of ableism and racism and things like that, and how do we address those things at their root cause? Because I think that is where we in all our good work can sometimes inadvertently enhance inequity. So we just want to make sure that we're identifying those where they are, calling them out, and then working to mitigate them.
Thanks so much. Do you guys have the team up and or Healthy Steps folks involved? We do, said Alex. Sorry, that was in the chat. I got a thumbs up for that. Kim added the definition of ableism. Thank you. And this is a strategies for children, dream come true. Workgroup 4 is in the house, and they'd say it would be great to think about the connections between Workgroup 9 and Workgroup 4, which is developmental screening, which includes referrals and accessing service. There's a lot of potential for really important alignment, and as both work groups move forward with the work. And next week, I think it's on the 12th, we'll have Workgroup 4 will join us for an update. So thanks for that, Carla. I guess back, when you think about the work and how it does kind of sit, and Allison, I think you talked a little bit about like how like in this huge system, like where do you pick to work on? How are you handling that? Is there any support or question that you would have for more folks to weigh in on? Maybe just talk a little bit about that.
It's a really great question. I think, because I'm coming from the healthcare perspective, I think there's some incredible barriers that healthcare providers face in creating linkages with anyone, in particular early childhood. And so understanding those barriers and trying to think of ways that we can mitigate them is, one of the focus that we're really, pinpointing. I think, one of the things that we hear a lot in the healthcare system is like, confidentiality, privacy, HIPAA restraints. There's also, a lot of regulations on the time that people spend with their doctor and billing and things like that. And so when we think about solutions and think about system level solutions, I think it may require some legislative advocacy on how we reimburse for certain services for medical providers, because unfortunately, and we hear this all the time, I think most of us are aware of the closure of the floating hospital at Tufts. Kids don't make health systems money, right? They don't. And so pediatrics practices, family medicine practices are always at risk of closure. And so making sure whatever we create does not add a burden onto the already strapped practices that are managing medical care for young children is really important, and finding ways that we can help them create the linkages that they really do want to create by opening doors and avenues for that is supported and I think this is the keyword, incentivized by payers. So to do anything in healthcare, there really needs to be a payment incentive. That's how we've started to get social care into the health system, is there's now incentives to address certain social determinants of health in the healthcare system. So nobody started doing it out of the goodness of their heart, unfortunately. And so I think really thinking about how do we create a system that we could then advocate for the way the payers think about this to change so that they can support children and families. And I have no idea where that thumb went.
You're giving yourself a thumbs up, Allison. I also just want to highlight, and Alex, I think by force or however you came to this work, we are grateful that people who do sit in the health, sphere are connecting back to early ed. We know, I mean, if you just think about the last few weeks on the 9:30 call with the data hub presentation that we had that are bringing some of these indicators and how we're collecting data together. Workgroup 4 working on this, having Rhonda Alexander with us, who's our facilitator for the stewardship group. And I think as we were imagining what this could be, we imagined there might be places where we would have to work together to prioritize, not fight about things, but really think about like, where are we going to put our energy? And so I think having Rhonda's perspective and facilitation to help, each of the work groups think about how they fit in this bigger system, not just in the early childhood agenda, but in life. That was pretty deep here at 9:57. So Allison and Alex, as you think about next steps, Amanda too, if you want to add anything, what does it look like for next steps for where you are in the process?
Allison, you mind if I jump in real quick, and then please feel free to run away with it. Next steps is how do we get our hands wrapped around all of this? So Amy, we've got the event information that we've got the early childhood agenda development information that we've got the asset mapping, we've got all of these pieces from the work group sharing and everything, and it's how do we get our hands sort of wrapped around this? The approach that our work group is sort of thinking about is because there are so many diverse perspectives, it will probably be easier for folks to react to something than communally draft individual pieces of that logic model or theory of change. And so what we're looking at is creating straw men pieces of a logic model to say, hey, now that we have all this information, the sort of leadership, the co-facilitators of this have put some of these pieces together. How does it feel if it looks something like this? What's your feedback? How do we think about this? How do we structure pieces as we move forward? And where people can push or pull and think about how that changes and develops is probably more reasonable considering how diverse the perspectives are that people have. And so we can add and subtract and make it make sense as folks react to something that is developed.
Yep.
From the facilitator.
Allison, anything to add?
Yeah, no, I think just people tend to, in my experience, do better when they have something to react to. So I
Right.
think we're gonna, create something with an open mind and open heart, and then share back with the group to get that feedback that we know we need to refine and adjust the model. But I think, just giving, kind of going out on a limb and giving some idea of what we're thinking from our perspectives, could work. And then sharing that back with the group is sort of that's our path forward.
That's great. Kim added a question about in the referral process, is EI to public school or center program public school, like the handoffs of EI. And I think we mentioned we have been in contact with a group that's going to come on the 9:30 call who's looking at this, the handoff piece of EI. And in Massachusetts, and correct me if I get this wrong, we have a big percentage of children in EI, but that handoff is not, doesn't reflect that kind of that big number getting EI services. We also had one of our advocacy network participants wonder, why do we stop at age 3 with EI? Are there other opportunities to go forward? So thanks for that. And then work group 4 has talked about that. Thank you, Neri. The next meeting for the work group 9 is March 1st at noon on Zoom. All the work groups are recording their meetings. They're on they're available for watching. We'll put those links in a follow-up. And also, if you are sitting there thinking, oh, this person I know should join this work group, or should at least know that is happening, please, we are looking just for people to join us, the perspectives, especially in some of the ones that are not, solely sitting in early education care, and just we want to think about your own networks and how we can expand and add folks to the work. Well, Alex and Allison, thank you so much for joining. And it's what a great opportunity to hear from you. What a great modeling you did for other groups coming on the 9:30 call. I appreciate the conversation and the slides, really helpful. So Alex, if you would have sent me those slides, I think folks are interesting, in seeing the theory of change work. So we will be back here on the 9:30 call tomorrow. And tomorrow we will hear from Leader Peisch from the Massachusetts House of Representatives. Thanks so much, and we will see you tomorrow. Take care.